sure of what sort of disorder this is, if this is environmental, neurological. That is why we are here, ladies and gentlemen. PTV loves to educate and inform you, and this is what we will be doing today as well.
Exactly, and which is why, ladies and gentlemen, it is actually referred to as autism spectrum disorder.
Right.
And the term spectrum itself is used because, you know, things can vary from 1 to 1,000. So, you know, it can be somewhere in between as well, where within the report, they even mentioned that, you know, it can go from being very worse to being very brilliant as well. So you never know. But gradually, I think every parent can help their child develop all of these abilities. But on the right-hand side...
I'm so sorry. And to
Yeah.
look at this video and believe that actually people living with autism made this.
Yeah.
They are so brilliant. I mean, look at it. They're nothing less than anyone or any person functioning with a normal brain,
Exactly,
right?
and just one simple thing, and that is the majority of the time people do confuse autism with Down syndrome as well, but this is something which we really need to ask our experts. So without any further ado, ladies and gentlemen, on my right-hand side, I've been joined by somebody who's actually the Assistant Professor of Psychiatry, Head of Child Psychiatry, Benazir Bhutto Hospital, Rawalpindi. She's none other than Dr. Aisha Minhas. Assalamu alaikum, how are you?
Assalamu alaikum, I'm good.
Wa alaikum
Thank you.
assalam. Thank you very much for joining us alongside Dr. Aisha Minhas. Ladies and gentlemen, we'll be joined by somebody who's actually very renowned globally as well. He's not just renowned over here in Pakistan, you know, wherever you travel, because unfortunately I had a backbone problem and I had to go travel abroad as well for the treatment. And even when I went there, you know, somebody took his name as well, and we are definitely honored that he's over here with us today, ladies and gentlemen. He is the former head of neurosurgery, PIMS Hospital. He's a neurosurgeon himself, Professor Dr. Khaliquzaman. Assalamu alaikum, sir. Sange khairam barobar. Thank you very much for joining us. It's wonderful to have you. Alongside Professor Dr. Khaliquzaman, ladies and gentlemen, we have been joined by somebody who's actually dedicated to work for children living with autism disorder as well. She's the Director, Autism Resource Center, Autism Specialist, Shifa International. And yeah, she lives somewhere around my house as well. So she's actually witnessed me driving in and out of 11. She's none other than Miss Halima Sadia. Assalamu alaikum.
Wa alaikum assalam. That was a nice introduction.
Thank you very much for joining us. And last but not the least, ladies and gentlemen, making her way for the first time into the PTV World Studios on the sets of World this morning, we've actually been joined by somebody who's a clinical psychologist, and she's actually working at the Autism Resource Center, Rawalpindi. She's none other than Miss Sophia Bukhari. Hello, assalamu alaikum.
Thanks for having me on the show.
Thank you very much for joining us. But first things first, how would you highlight the importance of this day? And this is a question for each one of you. Ma'am, we'll start with you.
So I think we need to spread awareness about autism. It is also known as autism spectrum disorder. Spectrum because it will range from very mild to moderate to severe, and each child is different with different symptoms and different grades of symptoms. And early diagnosis is crucial because early intervention is very important, and that's what's going to make the difference.
Right.
Unfortunately, here there is little awareness, and you know, even clinicians are not very well aware of it. So children are misdiagnosed or missed, and then obviously their prognosis is not as good as if the child was picked earlier. And you can pick a child as small as 2 years with autistic symptoms.
All right. So moving on to you, how would you highlight the importance of this day?
Well, let me first say that the experts are on both sides of me.
Right.
And take me as a layman as far as the autism is concerned.
All right.
I think autism is a disorder that needs to be acknowledged and needs to be simplified for the layman.
All right.
For the parents, if their children or if their child doesn't perform as well as they expect, how much is the expectations and what are going to be the end result by the end of it? They're looking after. How should they actually look at them? Because most of the time they expect too much, and every one of us is different. Every one of us, every child in the family is different.
Absolutely.
So therefore, I think before we say that a child is of autism, one needs to be absolutely certain before they break the news, and also perhaps the counseling is very important. I say this because what happens is once the child is notified as autism by our experts, the parents would take it as a disease. And what happens? They go shopping. They go from place to place and from doctor to doctor.
Okay.
And they at times end up with me. Just got nothing to do with autism, to be honest.
Right.
So I feel that aspect must also be highlighted in a program like this.
Right,
Thank you very
absolutely.
much,
So
sir.
moving on to you, ma'am, this is the 12th time actually the United Nations is observing this day.
Ji.
And Pakistan being one of the member states, of course, observes this day as well. Why was there a need for us to hop on board as well? And how important is this?
You see, we all know by now that autism is a neurological developmental disorder.
Okay.
And according to CDC, Center for Disease Control, 1 out of 59 children are being diagnosed with autism. And if you look at that figure, it's quite high
high.
and
Of
quite
course.
alarming.
Of course.
So I don't see a reason we shouldn't be talking about it today.
Yeah.
And I must add that media is doing an amazing job in spreading autism awareness, and I really appreciate your
Thank you
effort.
very much.
Thank you.
And the way you started the show, it's just amazing. That clip was amazing.
Thank you.
You've already, we know a bit about autism.
Yeah.
So that was a nice clip. And also, I'm just going to add to what they've already said. Like Dr. Aisha Minhas said, that early intervention is really important. For that, it is important that we improve our diagnosis process. So earlier you diagnose the child, and it's easier to start early intervention, and the outcomes are better.
Very nice. Ms. Sophia.
Okay, I would like to say that other than acceptance and awareness, we should also work on acceptance. That's why this day is important.
Yes.
And with awareness and acceptance, I take this day as a celebration for autism children, for children with autism, because you know we give them importance. We tell them that they're important, so that's why we are celebrating this day.
All right. Thank you
Right,
very much
okay.
once again for being with us as well, Dr. Aisha. I'm going to start the conversation with you, and we want to dig in deeper as well.
Right.
So while we were watching the report, the report said that there's nothing that the DNA is responsible for. The scientists till date do not know why autism happens to people who are actually
Right.
living with this disorder as well. But what can be the major causes generically, which we can probably look into and then realize that that these things might have led us towards a child who's actually autistic?
So I think just to begin, the cause is not entirely known as yet.
Okay.
So a lot of research is going into it. But what we know currently is that there is a very strong genetic component because it runs in families. If there is a pair of twins and one twin has autism, there is a much greater chance for the other child to be
Yeah.
born with autism as well. But it's not just genes. So it's a combination of genetic with environmental causes.
Okay.
So something in the environment which is not discovered as yet.
And so we still do not know what that is.
No, so that's where the enigma lies, because the exact etiology or the cause is not known now, but a lot of work is being done, and what is known now is that it's a combination of genetic, and even genetic, it's not a simple one gene inheritance, so maybe multiple genes
Okay.
and different combinations, and they are activated. I mean, there may be people who may be carrying the gene but
Right.
not have
Yeah.
autism
Oh, okay.
because of environmental influences.
So
it's
is it?
this-
Do we know if it's a suppressive gene or not?
By suppressive gene, you mean?
I mean, like you just already said, that if you do have, sometimes it's not even visible. I mean, sometimes you
Yeah.
don't even develop it throughout
Yeah,
your life.
so it will show itself when there is certain environmental influences. So
Oh,
it's
okay.
a combination.
Triggers, something
Yeah,
triggers it.
something triggers. Something in the environment is triggering it.
Oh, wow. And we don't know it.
And we don't know it, but we know that it's increasing tremendously. So it's doubled, and now 1 in 60 children.
Okay, so then I think what we can probably do to figure that out is that what might it probably be within the environment. So is there more witness within the rural areas, within the urban areas? Can we differentiate on these bases as well? Anybody who knows the answer can actually go for it.
Yeah, so actually, obviously we don't have the statistics here, but in US they have outlined some states like California and few others which I do not exactly remember. So there are about 4 or 5 states in which it is common, more common than the rest of the USA.
All right.
So what's happening there, God knows. But
I would like to
Yeah, yeah.
comment
Yes,
on
please
that.
go ahead.
I think that is because California, New Jersey, New York, these are rich states, so they have more funding. So a lot of families are moving into these states
Yeah.
Oh, okay.
because they have better services, because these are richer states.
Okay,
So that's
that
why
makes
number
sense.
of cases of autism are increasing there.
Right.
I mean, that makes sense to me. I don't know if that's
Right, makes
how-
sense,
yeah.
absolutely. But Dr. Saab, before the show, you had quite an interesting insight of how, environmental reasons might be connected to autism. Please go ahead with it.
Yeah, Well, me being an observer and also having these patients for no reason, as far as I would be surprised that if the parents bring the patients to me as a neurosurgeon. I'm not a psychologist, I'm not an autism expert, etc.
Right.
The reason is there is confusion in the atmosphere, in the surroundings. So people who think that a patient who had a head injury and he sustained and he recovered from it, and then he had some changes in his behavior or performance, then they come to me and they say that, look, what, he's survived, but he's like this. So therefore, they put, for example, they put this baby into that kind of spectrum. So what happens is, that's why patients come to me. And according to my experience, the rural people coming from the rural area, there are more special children with neurological development, in which you have some neurological deficit. But more urban areas, educated people, they are bringing their children with the symptoms that we've been talking about, for example, for autism. Now, usually there is communication, and we know that most of the communication, 70 to 80%, is by, say, non-verbal techniques. You don't have to speak. You just have to look, and you have to sit and understand, and you can show your interest, and you can expect this person is giving me the attention. So therefore, what has happened is that I noticed, for example, I was giving you the example just a week ago, people from Sultan came, and two small children, they came as a ride. So the first thing was, before the patient would sit on the stool, they would extend their hand on the table to shake hand, both of them, with me. Well, it was the first time. It was the first time they saw me, so they had no hesitation whatsoever. Similarly, the first time when I visited my village, and for the first time when I saw my nephews, they really just jumped on me in the morning when I was still in my bed. And we had that, perhaps I remember that the most. So what is happening is, when we come to the urban area, for example, I went with a family to a restaurant, and there were a big table, there were 4 generations. Grandfather perhaps, grandfather, father, and children. And one was the baby. And you would be surprised. I'm sorry, I just couldn't take the picture because of social reasons. I should have taken the picture. That would have been a picture of my lifetime, because the baby was seeing the cartoon of 6 months or so, and the mother was on the other phone. And everybody else was on the dinner at a very posh restaurant. So what is happening is that we get more,
sort of among each other, right?
I get more concerned people from the urban areas. Maybe it's because of the awareness, but then I am a villager. I come from a very rural background, and I now live in an urban society. Father goes in one way, the mother goes to work the other way, the child is with the servant or on his own, and to the people or to the television. And so therefore, it's very important that now this might come in intervention. So we are having automatical intervention. Now, why the West has taken it up and why it has become a big show is because I feel the society there is a lot different than the society here. And I think we have this kind of positive family structure that we need to reestablish, perhaps. Because, you see, just imagine you coming from the office and the children running towards you and hugging you, and now their uncles are coming and their aunties are coming, and they're all hugging them, and they feel that they are needed and they're wanted and they're loved. While otherwise, if you go to the West, if you even say hello, the mother would be staring at you. So the important thing is that we need to have these human values that has not everything is verbal, not everything is performing. You just don't have to act to be normal. So that is
yes, and I think that this is where the mother's role actually come in as well, because for a mother, what I've witnessed so far is that she does not really need her son or daughter to speak. She would look into the eyes of a kid, and she'll know what he or she needs as well. Which is why I want to move on to Halima Sadi over here as well, because we really want to know how it is to actually have been living with a child who's actually autistic, and then at the same time what autism really is for parents, how to cater to it, and then for the child, and then how can actually you make the child comfortable and your own life comfortable and worth living as well.
Okay, these are way too many questions.
Yeah.
So I'll
One by
take
one.
one question, yeah.
Yeah.
One at a time. First of all, we need to understand what autism looks like,
Yeah.
right? So when you have a child with autism, every single day is different.
Okay.
So there's no set formula that today this is how it was and tomorrow this is how it's
How it's going.
There are
to
no
be.
patterns, you're saying?
No.
No regular
So one good
patterns.
day and maybe 3 days in a row you will see severe tantrums or severe sensory issues.
All right.
These are the topics that maybe we need a day to cover
Yeah.
Okay.
what sensory issues are, because when you talk about autism, other than socialization, communication and behaviors, these children also have sensory issues, and due to these sensory issues, you can see some severities in behaviors.
Yeah.
Okay.
So yes, communication, socialization, repetitive ritualistic behaviors, these are the core components that you will get to see in a child with autism.
Okay.
These children can be diagnosed as early as 2 years. The signs and symptoms can even be seen earlier than that, right? But it's safe to diagnose a child after the age of 2,
All right.
right? Like Dr. Aisha has already mentioned. Boys are more likely to have autism, four
Yes.
times more likely to have autism
Yes, and
than
why
girls.
so?
We really do not know. We do not
Okay,
have an
okay.
answer to that.
Okay.
But yes, the research
I
tells
think
us
something
that.
to do with the Y chromosome. I'm just
Well,
assuming,
well,
but okay.
we're not really sure, but that's what the research tells us, that boys are more likely to have,
Okay.
4 times more likely to have autism than girls.
Probably we're just all over the place anyways, you know. So it's like that. Yeah, but go ahead.
And then, what we're looking at is autism spectrum disorder. And when we say spectrum, that means every child is on the autism spectrum is different,
yeah.
from the other. And I always give this example that if you've seen one child with autism, you've only seen one child with autism. So if you have like 100 cases of autism in this big hall,
Different.
all of them would be different from each other.
All right.
Okay.
Right? So we can't have one plan that we can implement on every child on the
Right.
autism spectrum. So we need to have a different plan according to the need of the child.
Okay. So you know, I'll simplify it for you as well, that, you know, how do you think that as a parent it affects the quality of life? You know, this is one thing which I need to know. And then how can you actually improve the quality of life? Because, you know, over in Pakistan, the environment or probably the society is not that supportive. So eventually, first things first, parent is in a denial. Okay, now they've started to realize that there might be a problem. And then, you know, they have this feeling of depression and anxiety
Right,
and whatnot.
right.
And then they eventually realize that, okay, you know, we are the only ones who are going to sort it out. So how do you think that this cycle works, and how can parents take help from all of those other parents who have children who have ASD?
Okay. The parents, obviously the primary caregivers, are under a lot of pressure,
Right.
right? So they, even if they do want to accept it, but they don't want to disclose it
Yeah.
because of the family pressure, the social pressure that they feel, and also they feel isolated as well,
Yeah.
right? And one thing that I would like to mention here is that the mothers are the most affected, mother is the most affected person in the whole scenario. I have seen mothers and the child on the autism spectrum becoming an alien within their families. So they're secluded in any family event. If there's a wedding, they'll be asked to stay at home or leave the child with someone because they can't take the child. Or the mother would be,
That's sad.
yes, that's a very common
Right.
practice. And being an autism specialist, believe it or not, I hardly ever see a father coming in with a child. Well, I do for the first appointment, and slowly but surely they start disappearing and stop participating in when the treatment starts. I do understand that they have financial responsibilities,
Yeah.
but then the mother needs the support of the whole family. That's where we're really lacking. Firstly, accepting that the child is different. Parents these days are really smart. They do realize that their child is developing differently, and they want to get professional help.
Yeah.
But
Right.
then, it becomes difficult because of all these pressures.
All right.
Okay, now moving on to you, Ms. Sophia. First of all, I need you to tell me, if you do develop ASD, is it for a lifetime, or can we end it, can we cure it, or just like treat it?
As you know, everyone has told, it's a neurodevelopmental disorder.
Yeah.
So that's the thing with developmental disorder. They're, you know, their lifespan, they're lifelong. You cannot cure it.
Okay.
And then another thing I would like to add is there is no medicine to cure autism. There are therapies, there are occupational therapy, speech therapy, there are sensory therapy, and then behavior analysis,
Right.
through which you can manage autism.
Yeah.
That can
Right.
improve the quality of life of the child and their families. But in our society and all over the world, there are, you know, very quacks, many quacks and all that.
Yeah.
So they tell the parents, so we have this formula that can cure your child, and parents are so, you know, so vulnerable for that.
Of course.
So they do get that idea, but that's the thing that needs to be cleared.
Right,
That
but
you
Ms.
can
Sophia,
manage
you know,
it, but you can't cure it.
Can't cure it. Okay, that makes perfect sense. But Ms. Halima Saadi over here mentioned that in the early 2 years, even you can sort of, you know, identify if it is ASD or not. But before you do diagnose that, or you do go see a doctor who diagnoses it, what are some of the symptoms that the family members themselves should be looking out for? Because they need to know as well, right?
I think the first symptom ever, you know, any family would talk about is jadoo tona and whatnot as well. So
Yeah,
I think
because
that's
it's a
probably
part
need to go to the experts.
No, but
every
honestly,
time,
it's
yeah.
a part of our society. That is what
Yeah.
we are, you know,
Yeah.
supposed to believe if we don't know if there's a
Yeah.
medical reason. or
I
not.
would like to, you know, tell the first few symptoms are very easy. They're very
Okay.
easy to diagnose if family is willing. You know, back of the mind, most of the parents know that there's something wrong with the child.
Yeah.
And what are these cues? You know, the child won't respond to their name. When you
Okay.
call to the child, they won't give you eye contact, and the child will, you know, will prefer to be alone or prefer to be remain in his world. He will be
Right.
obsessed with his toys. He will prefer to be, you know, other kids are playing of his peers and all that of his age, but he will prefer to remain alone and, you know, obsessed with his cars, or maybe
Okay.
and even his play is not functional, because, you know, when we give toys to the car, toys to the kid and
Yeah.
all that, so, you know, a kid's play is functional.
Okay.
So, but autism kids, they don't have any play skills at all in the early beginning.
Okay,
You know?
okay.
So with passage of time, they do develop skills, but these are the early signs. Then there is a very important, that's red signal of, you know, of autism spectrum disorder. That's their speech issues.
Oh,
Most of the
right.
kids are not nonverbal. So that's the point where most of the parents pick that they're
Probably autistic.
exactly. They first of all, they pick that their child has some issue, you know, because accepting for a parent that their child has autism is very difficult for a parent.
But the signs are easy to pick, you're saying?
Yes, signs are easy to pick,
Okay.
and then you know, there are two different types of autism. First is atypical. The child is not developing these. The child is not giving response to name. The child is not developing speech and all that.
Right.
Then there's a regressive autism. Like in early years, like in 2 years of age or 3, even 2.5 years of age, the child is responding to the name. Child is
Okay.
even speaking some words, but around the 3 years of age, the child is slowly and gradually he started to regress.
Oh,
Yeah.
okay.
So, you know, that's the point where
Right.
parents need to, you know, be very
Pay special
focused.
attention. Okay, that makes absolute great sense. But ladies and gentlemen, at this point, we're heading out to a very short break. When we come back, there are some myths related to autism that I need to bust over here. Maybe they're right, maybe they're wrong. We'll ask the experts over here. Stay tuned. Good
And if
morning.
she's going to give me a chance, I'll ask a few questions too as well. Good morning.
Good
right, ladies and gentlemen, welcome back. Thank you very much for staying tuned to PT World. You're definitely watching World this morning alongside Shiza Hashmi and Shahzad Khan. Today, ladies and gentlemen, is 2nd of April 2019, a very important day, and we've labeled it as World Autism Awareness Day. We are in conversation with a very apt guest as well. And before going towards the break, Shiza over here wanted to bust some myths as well. So Shiza, on to you.
Okay, so the first one I think you should be going on. This is about Down syndrome. You suggested this, so yes, go on.
So,
we have quite some 3 to 4. So yeah.
Okay, so Dr. Aisha, now over here, what I've witnessed, so far, whatever number of shows I've done is that people do confuse Down syndrome with autism. What are the differences, and how can parents actually rectify that that's Down syndrome or autism?
So as we've mentioned that the neurodevelopmental disorders is an umbrella term, and it includes autism, it includes mental retardation, it includes specific learning disabilities, it includes ADHD. So there is about 5 conditions that are included in this. Down syndrome is very different. It's trisomy 21, so the cause is known that it's chromosomal, usually with advancing maternal age, and it has a very different set of symptoms. What autism may be confused with is different grades of mental retardation, because autism, though in itself is a condition characterized by impairments in social interaction and communication. But many of the children with autism will have low IQs as well. So that combination obviously is worse. And children who have mental retardation only may have autistic symptoms. So there is a huge degree of overlap between, and you really have to be careful. It can also be confused with the communication, speech and language disorders on its own. Because if a child is not hearing, for example, and has not developed speech, he may not be making eye contact, may not be interacting socially as a typical child does. So there is a lot of overlap, and that is why diagnosis is not very easy. There are a lot of screening instruments and some diagnostic instruments.
And very quickly, so there's this thing, when you see a child with Down syndrome, the
physical appearance,
their physical appearance, one way or the other, identifies that they might have Down syndrome. Can that physical appearance be copied by a child who's born with autism?
No. In autism, the physical appearance is, as a typical child, and there is no typical facies. But in Mongolism or in Down syndrome, there's a very typical facies, and you can recognize a child when you see him.
All right. So Down syndrome is genetically not autism, but there are overlapping symptoms, you said. Now, moving on to you, Dr. Saab, it is very often said, and I've even read it in places as well, that you're more likely to develop autism if you have older parents. True or false?
We don't know. The experts
Anyone
said we don't know yet.
Well, the research says so, but I haven't read it in detail. But
well,
yes, the
let's. I'll take it. I'll
sure,
make a link
sir,
with Down syndrome.
Okay. Yes.
You see, yesterday I visited, a day before yesterday, I visited my village. And in the family, there is a little girl who is a Down syndrome. She, the same mother had another baby, and they brought the baby to me. Is it Down syndrome? Look, she's, no. I said, no, she's not. Because the features, and then the Down syndrome baby was there. And I put the music on, and she started dancing. So what happens is, the most important thing is the stigma, you see. This stigma of autism, when you put that in the mind of the family and the rest of when it spreads, what happens that our society is such that the child will get worse if they respond to him with, say, sympathy rather than empathy. Rather than enjoying his strengths, people will concentrate on his weaknesses.
Right.
So the most important thing is, all autism children, perhaps the experts would agree with me, that they have strengths and they have some weaknesses.
Yes, of course.
The strength, for example, with development, this is neurological development. That today, for example, I'm a neurosurgeon, and you are such an outstanding anchor person, you see. So what happens is that over a period of time, the mother knows what my child is doing the best. So concentrate on that. And why does he not give me, why he doesn't give me or she doesn't give me the attention when I call, under what circumstances, for example. So this means that he has certain strengths, my child, who is now a scientist, for example, and a great biopharmacist, And I still feel sorry for him because I did not actually encouraged him to do the painting.
Okay.
While he was 3, he painted the cat on the whole wall.
Okay.
Once I came back. But I thought, what would he do as painting?
Being a
So
painter,
I was
right.
not, I still feel a little bad that I didn't put him in, say, the School of Arts or
But
whatever.
30 years ago, you know, that's how things were as well.
That's how the things
Yeah.
were.
Right.
That where would he eat from,
Yeah.
for example?
But so very, very quickly, I'm sorry that I'm interjecting,
Yeah.
and since
No,
we're
that's
running
cool.
short of time, but ladies and gentlemen, we do have a good news, and that too is actually going to come from Professor Dr. Saab as well. So, you know, we've mentioned this quite a lot of times today on the show that it is because of a neurological developmental disorder.
Yeah.
Yeah.
Can it be stopped? Can it be looked into?
Yeah. Well, our society is rich in that.
Okay.
Why? I believe, I may be wrong. You see, what happens is, what we do is we read in the books, we have a research from the West,
Yeah.
and we try to implement it, and we try to sort of focus it in our society. Our society still has some values, and those values needs to be nurtured. I think we need to come together. We socialize the way you used to. We need to have our culture, and we need to have our identity and our strengths. For example, let me tell you this. If you see these cricketers that has come out of PSL or whatever,
Yeah.
I mean, you just see Australians, they are actually developed into a first-class team now,
Yeah.
but they just came from the streets, from the
Exactly.
back of the villages.
Exactly.
And I think we should be proud of that. So
Right.
we have quite a lot of good qualities that we can really build on. And I feel we need to emphasize on those strategies
Yeah.
that we can work on.
I
For
would-
example, doesn't-
Sorry, go ahead.
yeah. So what I mean is this, that I feel we are all different.
Yeah.
We are individuals.
course.
Take every autism child as an individual and treat or behave with him
Differently.
and grow with him.
Okay.
I always, you see, I have a friend whose son is not really very obedient.
Okay.
Okay.
I said, don't forget about whether he's obedient or not. Remember how many days you enjoyed with him since he was born, when he started growing, when he started walking, then he started running, then he went to school, then he played around,
Yeah.
and now,
Right.
you know, he'll be fine. You
Celebrate
have to
the
be-
strengths and
That's right.
individuality.
I think the most
So I would like to add to that.
Sure.
Initially, to accept the diagnosis,
Yeah.
and then focusing on the strengths of the child, and you need to discover your individual child's strength and then polish that skill
Yeah.
that your child has. To understand that there's no cure, but also to understand that autism is manageable, and you can live a decent life with autism depending on where you fall on the autism spectrum.
And very quickly, you know, since you're working for an autism research center as well, please let us know what kind of assistance can be provided at these centers. Very quickly, though.
So basically, the services that we are providing are behavior therapy, speech therapy, and occupational therapy. Recently, I would like to add that we did a project with NUST University Robotics Department.
Yeah.
So we did a research project with that. That was amazing. So yes, so we are moving towards assistive technologies for
Yes.
autism. And the most useful thing within autism, assistive technology is really useful when it comes to communication.
Yeah.
Because we need to remember that 1/3 of the population with autism is nonverbal.
Yeah.
Okay.
So we can really get a lot of help from assistive technology.
Yeah.
Right, thank you so much for saying that. And the theme for this year for Autism Awareness Day,
As you
ladies and
said.
gentlemen, is also assistive technology and focusing on them. Very quickly, Ms. Sophia, a wrap up or a small message for all the people out there on how to make this world inclusive for people living with autism.
Okay, that's very important because in our society, that's we rule out autistic children because they have some problems. They don't get along with other children.
Yeah.
So we have to create awareness. We have to create awareness for parents, for teachers, and for kids as well, for typical kids as well.
Exactly.
That they have to accept these kids. So what happens in the West is that in typical schools they allow one autistic child or one child with autism in every typical class.
Class,
Yeah.
okay.
So that's the thing. That's a pattern we have to follow. We we
Right.
have to create awareness with kids, and that's
Thank
how
you so
Thank
much
you
for
very
saying
much.
that.
Thank you
Awareness
very
and inclusion, ladies and gentlemen, is the answer. And as already mentioned, leveraging the use of assistive technology,
Yeah.
in the morning, is what we are looking at. We're looking at social, political, and economic inclusion of people living with autism, focusing on independence, probably independent living as well, smart home technologies, telemedicine, healthcare, education, employment, everything. So if there's anything you learned from our show, because I know I did, write
Yeah.
us on a Facebook page with the
Which
name
is
of,
with the name of World This Morning.
on Twitter.
World This Morning with without a G.
Daily Motion on YouTube.
Well, this morning.
And the repeat is going to be at
11 p.m. tonight. And before I say my last words, ladies and gentlemen, there's one thing which I think that the education providers need to be focused on, and that is that since it's a spectrum, so probably not the same courses are going to work for every child.
Right.
And we really need to be careful about that. So till the next time, 1, 2, 3.
Good
morning.
morning.